Terry Larkin. I'm here to talk to you about the different IUDs that we insert here at Goodman and Partridge. We have two different IUDs. We have the Mirena and then we have the Paragard. The Mirena is good for 5 years. It has progestins in it, which keep you from ovulating, keeps your lining nice and thin. So while you have a little irregular bleeding for the first 6 to 9 months, after that, a lot of people don't have any periods for up to 5 years, and that's a real selling point for the Mirena. Other people prefer the Paragard. The Paragard has no hormones in it, and it's good for 10 years. And that's its major selling point, is that it has no hormones. And the way that it works is it has copper in it, which keeps the sperm from wanting to fertilize the eggs. And again, both of them will thicken your cervical mucus so the sperm can't get in. The drawbacks to the IUDs are the risks of infection. We clean everybody with betadine first, so if you have an allergy to betadine or to shellfish, you need to let us know. And we test everybody for gonorrhea and chlamydia first, because we don't want to put anything in the uterus from the vagina. Every once in a while we'll have a patient come back that has flu-like symptoms, chills, we'll give them antibiotics, no big deal. Big deal is if we perforate the uterus with the insertion tool, the uterus heals right back up, but then you have this IUD, it's floating around your abdomen, they actually have to surgically remove it. Only happens 1 in 10,000 cases, and it can even happen after it's already been inserted. It just occasionally will work its way through the uterus. So we encourage the patients that get the IUDs put in to just once a month when they're in the bathtub, put their fingers in, see if they can feel the strings. If you can't feel the strings and you're worried about it, come in and see us. We'll do an ultrasound just to check placement for you and let you know that everything's okay. Prior to putting in an IUD, we'll give you a prescription for a medication called Cytotec. Cytotec opens the cervix to make it a little bit easier to insert. It can cause a little bit of cramping. You don't want to take ibuprofen with it because it will work against the medication. And then some providers like to do a ultrasound prior to inserting it, just to make sure that your uterus is the correct shape and the correct size to hold the IUD. And it also kind of cuts out a painful part of the process where we measure to see how long the uterus is. After we put in the IUD, we'll also order an ultrasound like 2 weeks afterwards to make sure that the uterus hasn't tried to push out the IUD. A lot of times if you haven't had children, the uterus isn't used to having something in there, so it kind of contracts afterwards. You can have some cramping. And then in 2 weeks when we do an ultrasound, it's in the lower part of the uterine segment. And this diagram here is a kind of a picture of the uterus, and here's the ovaries, and here's the IUD, and you can see that it's kind of sitting here at the top. It has to be at the top to be effective, and so if the uterus has tried to push it out, then sometimes it ends up down here in the lower uterine segment, and we have to pull it and try it again. And that's one of the reasons why we like to do an ultrasound, is just if you're going to be having a birth control form that you're going to have in for 5 or 10 years, it's just kind of nice to know that it's in the right place. Sometimes partners will say that they feel the strings. If they say that they feel the strings, then you can tell them that over time they're going to soften because they're in a moist environment. I always tell my patients not to tell their partner they may feel the strings, because then they always feel the strings, because that's the way men are. Anyway, so if you're interested in the IUD, come talk to us. We do them pretty often, and they're a really awesome form of birth control. Some of the patients that come in remember the IUDs from the old days that were kind of S-shaped, and have horror stories of babies being born holding the IUD or having infection. And we've come a long way since then. They're a different design, and people seem to really like them. So come in and see us and talk to us about it. We'll see you at the office.